Hello, I'm Jon Sager, retired clinical associate professor in the School of Social Work at USC. I'm the vice president on the board for the California Social Welfare Archives, and we're here today at USC on June 23rd, 2014, to interview Bruce Jansson, a recent recipient of our Francis Feldman Excellence in Teaching Award. Bruce is widely credited with having invented the term policy practice. He is the Driscoll Clevenger Professor, Endowed Chair of Policy Practice and Social Administration. He's written a number of books in the area that are real classics, and so we're delighted to have him here today. Thank you. Bruce, maybe we can begin with you telling us how you got started in social work.
Thank you. Well, I'm delighted to be here, very much honored to be interviewed by the California Social Welfare Archives Association, which does such noble work in preserving archives in the field of social welfare.
Yes. Bruce, tell us how you got started in social work.
Well, it's actually somewhat of a humorous story. I graduated from Oberlin College and had not a clue what profession to select. So almost by default, I retreated back to my undergraduate major, entered Harvard University, got a master's degree there, but even during that program, very early in that program, I decided history was too esoteric, but I had no idea what to do. So I looked in the yellow pages in Boston and found something called the Social Work Vocational Bureau. I have no idea what it was at all. All I know is a very pleasant sounding woman answered the phone and she said, by all means, come in and talk to me. I'll tell you all about the field of social work. So I went in, she told me what it is or was at that time. And then I said, well, where would I apply? She said, well, the top schools are Columbia, Case Western, and the University of Chicago. Why she selected those three, I have no idea what she did. So I applied to all of them, but I knew a lot about Chicago because I had taken summer school 1 year there. To prepare for my interview at Chicago, at the school, I read all the books of Jane Addams back to back. Remember, I was a history major. And I thought she would ask me about these books, about Jane Addams. So I take a Greyhound bus from Boston to Chicago. I'm hardly awake. I'm all primed for the questions about Jane Addams. And she asks me questions like, have you ever worked with people? And things like this. And so I told her I had pretty meager experience in summer programs and the like. And to my absolutely amazing, 3 weeks later, I'm back in Boston, I got a letter saying, you have been admitted, you have a full NIMH scholarship. All of us back then had full scholarships. It was almost automatic. And so here I could go to this school for 2 years without paying a penny. In fact, my wife and I figured out we actually made money on the deal. And so that's what I did. I went to, and I remember the night before I enrolled, I was listening to a talk radio program in Chicago, and they were talking about something called AFDC. And I kept trying to think, let's see, Americans for, I didn't know what the letters meant. To show you how naive I was and out of it I was. And of course, I soon discovered my field placements there. My first field placement was a public welfare agency. My second field placement was as a tenant organizer on the near north side of Chicago in a low-income African-American community. A slum landlord. We were trying to extract some concessions from him in terms of fixing up his buildings. So I rapidly got into what the field is, was delighted I made this choice, and that's how I got into social work.
What were some of your, how did you progress then from once you have now entered social work and you're getting your MSW?
Okay, well, I got my MSW. then there were lots of jobs back then. It was in the war and poverty days. So I became a tenant organizer at a settlement house in Philadelphia, the Germantown part of Philadelphia. Continued organizing tenants, and also set up a kind of a community building program where we brought in some volunteer architects from the University of Pennsylvania. They worked with local residents to develop a community plan, and we got the federal government to step up and contribute roughly $10 million toward that plan. So we were able to build affordable housing, put in some pocket parks in a low-income black area, and that was actually a most interesting job. Lasted a couple years. Then I took another job in Lansing, Michigan, with something called the Michigan Welfare League, which was a state-level job working on housing issues, and was there a pretty brief period before I went right back into the doctoral program at the University of Chicago, where I had gotten my master's degree. And I was there for 3-4 years, and then my first job out of my graduate work was here at USC. So I've been at USC from 1973 onward.
You mentioned earlier something about 3 areas that you were wanting to address.
Okay, I think my major contributions have been in 3 areas. And one, policy practice, which you mentioned. We could come back to that. Second, what I really regard as building values for the social work profession, because values so much determine what we do in our field. And then the third one is expanding policy practice in new directions, which is what I'm currently working on. So those are the 3 major areas, all of them in policy and policy-related matters. I was hired at USC, by the way, to replace the late Norris Class. He was the sort of policy guru for many years prior to my coming. He retired literally the year before I came here, and I was hired to replace him. And I will tell one funny anecdote about this. As I was being interviewed by USC for the position, it was at a CSWA conference. It was at 8 o'clock in the morning. I was hardly awake, and there were 6 USC professors in a semicircle around me interviewing me. For some reason, the first words out of my mouth were, "Don't be nervous, just relax." And they looked at this young candidate for this position with kind of astonishment on their face. Why would this individual say that to us? But they did laugh about it, and when they got back to USC, I was told later, they kept thinking about this individual who had made that most idiosyncratic comment. And I think maybe for what reason I got that job here, who knows? But anyway, it's just kind of a humorous aside. So I came here. Francis Feldman, the late Francis Feldman, was my mentor in the first year. And having been designated to replace Norris Class, of course, then I taught policy primarily, but I also taught research. And I was in the school. Maurice Hamovich was the dean and had been already for a number of years before I came here. So that's where I came. That's how I came here. I will say again, humorously, all the faculty, aside from one at the University of Chicago, everybody said, "Do not go to Los Angeles," because the image of Los Angeles at that point in time was smog, earthquakes, kooky people, and the like. And so I saw through all that haze that they put in front of me, and I did come here, and I'm delighted I did. I always liked the collegial culture of this school. It was collegial then, it's collegial now, and it's an attribute that many institutions of higher learning do not have, it turns out. And so I was attracted to it, and I'm delighted I came here. Okay, so for the 3 areas, let's start with policy practice. My first assignment was to teach the basic introductory policy course. And I enjoyed that. It was mostly, there was a semester of history and a semester of sort of current policies, philosophy, and the like. And having come out of the 1960s, you have to realize that was my informative period of my adulthood were the 1960s, the tumult of it, the civil rights movement, and I've already mentioned I was a tenant organizer for a number of years. I came into the school where policy seemed strangely out of sync with that. For example, there was absolutely nothing on how you changed policies. And it wasn't just unusual to USC. CSWA put out a book in the early 1960s about what the good policy curriculum would look like. And it was roughly 270 pages long. On the very last page, in like 3 sentences, after all of this other content, it said, and I guess you should learn or try to change policies that you don't like, type thing. But that was it. So I kept thinking, how could I inject something into that subject matter that would really give social change, social action, some major role? Because to me, coming out of the 1960s, policy meant, at least in part, reform. That was the period I'd grown up in. So I kept stumbling around trying to figure out how to do this, and I came up with the term policy practice because I thought we are a practice discipline, and many of the students who take these courses are practitioners, view themselves as either direct service practice or some kind of practice. So I thought if I called it policy practice, it would resonate with students and other people in our field. So I took 4 years to write a book on this topic. So it began right after I got tenure, and I worked on it for 4 years, trying to figure out what framework would I use, what terms would I use, and I wanted to make it very practical. So I came up with, at the time, 6 tasks and 4 skills. And I won't go through the 6 tasks, which have now become 8 tasks many years later, but the same basic 4 skills, like value clarifying skills, political skills, interactional skills, and analytic skills. So those skills combined with the 6 tasks, which sort of took you through the policy-making process, became the framework that I used. And I had fun writing this book. There was no such book around that I could find. Nobody had used the term policy practice that I could find. And so I was starting from scratch. And a kind of humorous story, the late Paul Conrad, who was a cartoonist for the LA Times, very famous Pulitzer Prize-winning cartoonist, I decided to insert one of his cartoons in each of the chapters, just to enliven it. And one was a man in a Wall Street suit, very formally attired, a very rotund individual, and he had gold coins in this hand, and he was dropping them into this hand, and the caption was "Trickle Down Economics." So I think that those kinds of things. Anyway, it came out. The publisher was reluctant to publish it. They didn't think there'd be a market for this book. And so I had no idea, would people buy into this? Would they like this? Would they not like this? Because it was totally new. And surprisingly, a fair number of schools did decide to use it, to my absolute astonishment, actually. That book is now in its, I changed it a lot between the first edition, which also covered policy sectors, had policy practice and policy sectors, and eventually in its third edition, it became exclusively policy practice. I decided that required a full book, a full treatment, so I dropped the policy sector materials out of it, and that became a book. It's now just entered its 7th edition, to my pleasant surprise also, and it's way thicker than it was back then in the first early editions of it. So that's sort of achieved its goal. I don't know, to be truthful with you, how many students who've read that have gone on to be policy practitioners in their own work. We don't really have good data on that. But the wonderful thing about it is that partly due to the work of Bob Schneider, who was the head then of a thing called Influencing State Policy, a group he started. The term policy practice actually got into the CSWA accreditation standards. So it's a required content for social work curriculum. You cannot be accredited if you do not teach policy practice. And that was just luck that became, and I take great pride that I had some small role in that, because now it's very much integral to our field, how we think about policy, how we teach it, and hopefully what we do with it once our students get out of their graduate school education.
How has that changed over the years?
Well, it remains and has always remained part of the accreditation standards. The book is, in its basic structure, kind of pretty much like it was way back, say, by roughly the third edition of it. I've added, as I say, a lot of materials to it. It's become much thicker, but the basic content, the basic concept remains the same. Policy is something you can practice. It's not just esoteric, it's just not just theoretical, although it has theoretical elements. Analysis is one part of it, but only one part of it. That was another kind of challenge. A lot of policy folks, faculty, thought of it as primarily analytic in nature. But if you can analyze from here to doomsday and do a beautiful job of producing a beautifully crafted piece of policy, but if it doesn't get enacted, it comes to naught. And the value of what I did, I think, was that it made clear that there's politics as part of this. There are skills involved in getting this through the policy process. And you do have to do careful thinking and analysis, but that's only part of it. It needs all these other things also as part of it. So that basic structure and viewpoint about it has remained pretty much the same. And as I say, because of the accreditation requirement, it's widely taught in the United States. And fortunately, other people have written books on the topic, which I welcome, so we have more people writing about it, thinking about it, and doing it. I just came back from a conference in Austin, Texas. We used to have an annual conference of people interested in policy practice until Bob Schneider, who I mentioned started influencing state policy, retired, and that sort of fell off. Well, a group of young faculty started up the annual conference again, which we just had a month ago in Austin, Texas. And I was delighted to see a lot of faculty came to that from all kinds of schools all across the United States. So I think it's alive and well. We just don't, I'd like to have us be even more doing research on policy advocacy and the like. Our doctoral program here just recruited a first-year doctoral student named Melissa Bird, who got 5 pieces of women's reproductive rights legislation through the Utah legislature. Can you believe that? She was the chief lobbyist for Planned Parenthood of Utah. So I'm hoping we can recruit more doctoral students who have a policy advocacy interest to do research in it and to spread the word as they get out of our doctoral program. So I think it's there, and I think it's doing fine. The second area that I think I played or tried to play a role in it was trying to reinforce the value base of our field, social work, so that we continue in the Jane Addams tradition of being social reform minded, not aware of issues past and present, trying to understand how our field of social work is very different from most other fields in that we have this very reform-minded tradition going way back to the founders of social work. And my primary way of doing that was history. Way back when I was talking to the woman at the Social Work Vocational Bureau in Boston, trying to figure out what field to go into, I said to her parenthetically, I'm automatically going to get a master's degree in June, where I was then. Should I even continue the program? If I'm going to go into social work, maybe I should just drop that and forget history. She said, oh no, Mr. Jansson. She said, you'll be one of the very few people in the field who has a master's degree in history. You'll be a true leader. I should remember those words. So I thought, candidly, when I left history, that I would not do anything with history once I left history and was in social work. So I guess it's not surprising because we're all creatures of habit. I was very unhappy with the current history books, social welfare history books that I encountered when I first started teaching USC. They were very distinguished scholars. one at Berkeley and one at the University of Wisconsin, who had written sort of textbooks on the social welfare history. I found them, almost like I found much of the policy literature, to be excessively removed from the realities of history. There was very little talk about social movements, very little talk about vulnerable populations in those histories, very little talk about injustices in American history, except in a kind of sanitized way, such as the genocide we did with Native Americans, such as the internment of Japanese Americans in World War II. So I was determined, and not as much talk as I thought they would do about some of the great reformers in our field, for example. Very parenthetical discussion of some of them, like Dorothea Dix, like some of the great progressive reformers, the New Deal reformers, and the like.
Harry Gould.
Harry Hopkins?
Harry Hopkins.
Yeah, people like that. So I wanted to highlight those people with bio sketches of them in the book. Actually, I didn't do that until several editions after the first edition. So I went to a publisher, and I said I would like to write this book. And they said, "Oh, Mr. Jansson, there's no audience for that book. We're not going to publish that." But I persisted. I kept pushing out the door. And finally they said, and I never will forget these words, they said, "We'll publish this as a service to the profession." Sort of like it was a duty. But they didn't obviously expect it to be used much at all. So I spent 4 years doing research for this book. I read all kinds of historical books on all kinds of topics, and it took me 4 years to write what became, and I decided to call it The Reluctant Welfare State, for obvious reasons. We do have a welfare state, but it's a reluctant welfare state. And that became the title of this book. I'm pleased to say it's now going into its 8th edition. It's being used in a lot of places around the country, and my purpose, again, I think, was at least partly achieved in those programs that use it, to just reinforce the value base of our field and also give people a healthy understanding of how we came to be what we are. And I tried to accompany my book, The Reluctant Welfare State, with interesting teaching materials. And inserts that would ask students to really think about things. So, for example, one of them I remember vividly was, imagine you're Franklin Delano Roosevelt, and liberals are on your case. They want you to pass anti-lynching legislation, a sad part of our history. Thousands and thousands of African Americans were lynched in the South, often as people watched them eating their lunch. It was almost a festival-type atmosphere as they hung these poor individuals. And understandably then, lots of liberals, like the late Senator Wagner of New York, would say, we have to pass federal legislation to stop this atrocity. But Franklin Roosevelt faced the reality that all the chairs of all the congressional committees were Southern Democrats, all of them. And he needed the support of the Southern Democrats to get the Social Security Act passed, to get all the legislation he passed in the New Deal. So he was in a horrible bind. If I propose and support anti-lynching legislation, they will all rise up against me. But if I don't, I've got these liberals on my case. Well, perhaps unfortunately he didn't pass and even support Eleanor Roosevelt. His wife kept pushing him to do so, but he didn't. And so, what would you do, I say to the social work students in a little insert in the book on the New Deal? How would you resolve that issue? So it forces them to think about tough choices, how, these are difficult issues to make, decisions to make, particularly for the person at the time who faced a context that we don't have today, fortunately, with the Civil Rights Act long ago passed. Again, to my surprise and to the publisher's surprise, a number of schools use this book. So that book has continued. It was a thin little book in 1988 when it first came out. Well, I've updated, revised it every 4 years for each succeeding presidency. So what was a book very thin in nature is now a pretty thick book, because it carries the last edition goes through the first term of Barack Obama's presidency. And I think keeping it up to date is very important because it makes students realize the point I'm trying to make, that we can connect it to the present. Most of the history books that are written about don't come up to the present. I was determined to do that, and have done that ever since. Then I did another book in history that actually I'm kind of proud of. It didn't have such a big readership, but it was a book on American national budget priorities. And I started this book. I didn't know what I was getting into, to be frank with you. I had heard after the Vietnam War, there was a big battle over a so-called peace dividend. And the late Kenneth Galbraith, a Nobel Prize-winning economist, had tried hard to say, with the Vietnam War over, we should change our budget allocations at the federal level. Cut military spending, put much more into social services and social programs. And I was amazed that at the time when I started research on this, the Cold War had just ended, Soviet Union had collapsed, and there was beginning to be a little talk about a peace dividend there too. And I thought, well, I'll try to find a book on this. There was no book. So I decided, okay, I'm going to write a book on budget priorities in the United States from Franklin Roosevelt through Bill Clinton's administration. And I just didn't realize what I was getting into. This was a incredibly difficult piece of research. Why so? I had to learn lots of things about military spending. I read more books on military spending and military budgets and armaments than I would ever care to tell you about. Then I had to read books on the federal budget process and how it's made. Then I had to read books on American tax policy, because that has a lot to do with how much money we have to spend and who gets it. Then I had to read a lot about social policy, the budgetary part of social policy. Then I had to go to every presidential library I could find. I went to the Franklin Roosevelt Library, the Dwight D. Eisenhower Library, the Harry Truman Library, the LBJ Library in Austin, Texas, and did a lot of research in the archives to find out the politics of budget priorities in those different presidencies. And I had to read books on other presidencies like the Reagan administration, the Clinton administration, how the battles within them about budget priorities. And so after all these years, so I really literally spent 7 or 8 years of research, off and on, not straight, going to these libraries, doing this research, had no publisher, and had no title. So I'm almost at the last minute. I was looking at historical tables of budget spending, and I was actually able to roughly calculate what I viewed to be squandering of resources on armaments, and I could rely on all these sources I'd been reading. So I came up with a title eventually, The $16 Trillion Mistake, how the United States bungled its national priorities from Franklin Roosevelt through Bill Clinton. And I finally did find a publisher. Columbia University Press published it, and all the reviews were very positive, even on the conservatives, and not one reviewer said I made an error of some sort, which was kind of a feat because I was in all these areas like military spending and blah blah blah. So that book was one more part of my historical background, and I've always wanted to update that, but just haven't had the time. Okay, the third thing I've done. So we've got that's the values, but certainly values have a lot to do with budget priorities. Your values witness the battles between conservatives and liberals right now as we speak in 2014 in the Congress over budget priorities. So that was, again, a value-oriented thing, although I had to use lots of data and information to write that. The third area that I've been working on is to modify my discussion of policy advocacy, let's call it almost democratize it, by pushing it downward so that what we call in social work case advocacy, what they call in the medical field patient advocacy, becomes part of it. And so I'm writing a book. It's coming out in January of 2015. So we're going to be published by Sage Publications, which will do two things. First of all, present a framework of what I call micro policy advocacy, Mezzo policy advocacy, and macro policy advocacy. Micro policy advocacy will be what we used to call case advocacy. Mezzo policy advocacy will be policy advocacy at the organizational or community level. Macro policy will be in the government sector, which I had written about before. So that project, and then I was also determined to apply it to sectors, because social workers work in sectors. They work in the mental health sector, the child welfare sector, the health sector, the schools, corrections, and on and on. So the book, the first 6 chapters of the book explicate the 3 kinds of advocacy: micro, mezzo, macro, and then the last 8 chapters are on sectors with the title Practicing Social Policy in, say, the health sector, practicing social policy, say, in the mental health sector, and so forth. And it took me some time to find a publisher. One publisher went bankrupt just as they were about to publish this book. And then another publisher who said they wanted it decided not to do any more textbooks at all. And finally, Sage came through. So I'm just delighted about that project. Now, that project is linked to another book I wrote called Improving Healthcare Through Advocacy, where I did this in the health sector, even prior to the Sage publication, where very much, for years I taught social policy to health sector concentration students, all placed in hospitals. And I'd ask these students on many occasions, have you ever heard, these are second-year MSW students, I would ask them, have you ever heard the term case advocacy? And nobody had ever heard the term. They didn't know what it was. They had received nothing on that in their entire first year in the curriculum at this school, and I suspect it's true at other schools also. So they had no notion about how you are an advocate for individuals. And in my way of thinking, advocacy is not limited to macro policy with legislatures and the like. It starts with individuals. It starts with somebody, say, who's not on the food stamp program, who's eligible for it. And if nobody steps up with that person and says to them, I don't want to pry, but might you be eligible for the food stamp program, now called SNAP? And in the course of a discussion, you find out, oh, I think maybe you are eligible. So here's how you get onto that program. That's called patient advocacy or case advocacy. And we weren't teaching our students how to do that. Mezzo policy advocacy, similarly, even though I had discussed it in my books on policy advocacy at macro levels, like at the organizational level, I really hadn't separated it out as a separate kind of advocacy, but I think really it is. Because doing policy advocacy in an organization is very different from doing it in a legislature. It's certainly very different from doing it with an individual. So the book I wrote on improving healthcare through advocacy laid out 7 categories of problems that hospital social workers encounter, and then spelled out all kinds of scenarios where they might in fact become patient advocates, or what we call case advocates. And that book got published and has done well. And I had so I expanded that by including mezzo policy advocacy in the book that will follow it, the Sage book. One anecdote, and I'll just quickly get through. As I was working on had just finished the book on healthcare advocacy, that book. A doctoral student I was working with went on the internet and found that an agency called PCORI, the Patient-Centered Outcome Research Institute, which is the research arm of the Affordable Care Act, was putting out a call for grants. And so she said to me, look at this, it's right up your alley. You could do a thing on research on advocacy in healthcare settings. We put in for this and we actually got this grant. It was a $700,000 grant over 2 years. We're just finishing it now, and we got all kinds of evidence now, empirical evidence, that in fact hospital social workers see all kinds of issues and problems that patients have where they do in fact do patient advocacy, the equivalent of case advocacy. And we now have data on this. So it wasn't something that we made up. It's real. We have data showing it occurs, and we found out what causes or what interferes with them doing it. Some of them do more of it than others. We tried to figure out why that's the case. Came up with some interesting data, and we're writing articles on that right now. So I view it as a way of kind of democratizing policy advocacy to take it down to the level of individuals and organizations, then keeping the macro, the government part. So that's my third area of where I've worked.
How have you seen the milieu of social work and policy practice change over the course of your career?
That's a good question. I'm not sure I'm the best commentator on that because, candidly, most of my work has been done at a scholarly research level. To do these various projects has virtually taken up most of my time. So I've not been floating around in the outside world trying to assess exactly what social work is doing. I see promising things at NESW, where they seem to be doing a fair amount of work in advocacy. And of course, we have chapters in all of the states, including California, which focus on advocacy in the state legislature. The students seem very interested in advocacy. The course we teach to them, I just taught it last semester. They got into all kinds of advocacy projects around state issues and state legislation. Went to Sacramento for lobby days. So, there always could be more of it. Maybe there isn't enough of it. We need to measure more how much is actually done by people once they graduate from our schools, and how we can work out there to make it even better. Someone who was an adjunct teacher here, then became the dean of the School of Social Work at the University of Connecticut, has very interesting training sessions where she's trying to get social workers to run for public office. And a doctoral student of hers discovered that roughly 550 social workers they could identify around the nation are in one form or another of public office, from school boards on up. So a lot of us are now getting into public service, which I think is a wonderful development. And I hope we continue that. I wish we would do that here at USC, have a training system for getting people into elective office and public service, because then we would really be right in the middle of it. So hopefully we can work on that front and get even more work on that front. Let me say just another word about advocacy training. Because now that we've got the data from these 100, we actually surveyed 100 social workers, 100 nurses, and 100 medical residents, who we call frontline professionals in hospitals, 8 hospitals here in LA County, about advocacy. So using an online survey we developed and drawing on my typology in the book on healthcare advocacy, we developed a list of 33 kinds of issues that healthcare workers see, unresolved patient issues. And we asked them, if you saw a patient with one of these issues and you thought it would really harm that patient's well-being, and you thought that if you didn't step forward to help the patient, that patient would not get assistance with that unresolved problem that would harm their well-being, did you, during the past 2 months, engage in patient advocacy? Did you try to come to the assistance of that patient or not? From never to almost always. And we got a full spectrum of responses from these frontline health workers. A considerable number did say they did patient advocacy during the past 2 months with regard to many of these 33 problems. But a number of them said not very much, or not at all even, practically. So that made us realize, even at the quote-unquote lowest level, which is patient advocacy as compared to Mezzo and macro policy advocacy, it's a very uneven thing that goes on out there in the real world. So we decided in our next grants we're going to try to develop technology to do effective advocacy training for those healthcare workers. Not just for a few of them, for the entire staff of an entire hospital. So as many as 5,000 people in one institution. This will take doing. We've got to get research funds to do this, but we're on track, I think, to try to do that. And if we can do that, we have baseline measures. We have validated scales we developed in this project to determine how much advocacy they currently do. We give them the training, then we do a post-test measure to see, does it increase the amount of advocacy they do? Well, if this works in hospitals, why couldn't this work in any social agency? A mental health agency, They have unresolved patient problems there also. What about a child welfare agency? God knows they have unresolved patient problems, as we've seen with the travails of the LA County Department of Health Family and Services, Children Family Services, where they've had scandal after scandal, where unresolved problems have sometimes even led to injury or death. Well, what about schools? You know, kids are going around schools with all kinds of unresolved problems, and their teachers, counselors, social workers have to make the same choices. Do I step up and become a patient or a case advocate or not? And if I don't, do I realize that that person may suffer because I didn't do it? So we could have training there about advocacy if at the lowest level, client or patient level, and then we could say to them, wait a minute, why aren't you? Why does that child have that problem in the first place? Let's say it's bullying as an example in a school. Well, are there some policy issues at the organizational level that need to be addressed that might decrease the amount of bullying that occurs in the school, such as by setting up a more benign culture? Or are there policies in the school that prevent teachers, for example, or social workers from stepping up to the plate if they see a child being bullied? Maybe there's a hostile atmosphere here to advocacy in this organization. There is in many hospitals. For example, in the hospitals we surveyed, 60% of our respondents said they often experience hostile behaviors from fellow professionals when they engage in advocacy. It's a key factor as to why some people don't do it. So I think what we're doing in the hospital setting can be applied to any social work agency or program. So we're going step by step here. We're trying to figure out how to do it in hospitals, figure out how to train effectively people to do advocacy. Then if we can make it work there, and not just advocacy at the patient level, but the organizational level, the Mezzo level, and the macro level, can we then or not transport it to social agencies that other kinds, like mental health, child welfare, education, and the like. That's our hope. And if we can do that, then we will really put some real heft behind advocacy, which, by the way, will then go to people who've already graduated from our school, because that's what I'm most interested in. It's great to have MSW students say, oh, I'm really turned on by advocacy, but if they don't do it once they leave the school, what have we accomplished? So this will be really for social workers after they've left the school, if we can pull this off.
It's amazing.
I don't know if it's amazing until we do it, but it's the idea. You know? And I guess it's really been fun to actually do this empirical work that I have not done because I focused on books earlier. Because it's a kind of new dimension. My office has even been moved down to the Hamovich Research Center, and that's where I work now, downtown.
So you're finding the research being more gratifying now than it was earlier, or just?
Well, I didn't have time. I did my first 6 years here before I got tenure. I did do empirical research. But thereafter, I was so focused on the various books I did that I didn't really have time to do it. And now I am focusing on it and finding it kind of interesting, particularly because it's in my area of interest, advocacy. That's definitely the theme I've had throughout my years here at USC. Candidly, I didn't fully realize that until Marilyn Flynn, our dean, asked me maybe 3 or 4 years ago to write just a one-pager as to how would I characterize my scholarly research work. And I started putting down the various things I've done, and finally I realized at the end of it, oh, my theme has been advocacy. I didn't quite realize that. And so in me, I really hadn't objectified it as what I actually do and have done all the years I've been here. And it's definitely the theme around which I've organized my work. And now we go back to the 1960s, because that's the environment I came from. That was an era of advocacy. The late Molly Ivins, the wonderful columnist from Texas, who wrote the book about George W. Bush, which she called Shrub, was asked about what had motivated her. She was a populist journalist. And she said, I have fed off the 1960s my entire life. And to some extent, that's true of me. I grew up in that era, and it just came through to me as my interest. And that's what I've done all the succeeding years.
If someone was growing up in this period right now, what kinds of things that you think that would shape them, 20, 30 years from now?
Well, the big issue, as we all know, is equality. And maybe they'll be motivated by the sheer enormity of problems like equality in the United States. We are so inegalitarian in our society. The haves versus the have-nots. The data are just alarming. That 50% of our population live below, at, or near poverty. That people at 65 who retire, 50% of them have no assets. They have credit card debt. They don't own their houses. All they have is Social Security and Medicare. They have no savings. 50% of everybody who turns 65. And as you well know, that people now live to well into their 80s or 90s even. How are these folks going to survive all those years? And the gap between Caucasians and African Americans, which had gone down over a number of decades, has now risen up again in the wake of the Great Recession of 2009, 2010. And it's harmful with a capital H to the folks in the bottom half. And of course, particularly the people in the bottom quarter. So this is the big issue that's facing our country. It's getting more attention. Fortunately, President Obama is now focusing on it. I just heard Hillary Clinton, or shall I be partisan? Maybe our next president, talking in a town hall kind of setting on CNN, where she said she too is very interested now in the issue of equality and how do we move back to a less inegalitarian society. So I think maybe as our contemporary social work students see these huge social problems around inequality that shape all of what we do in social work, for example, low-income people in the health field die earlier, die sicker, have more chronic illness, they have more mental illness. They have all these problems that stem from their poverty and their lack of resources and the anxiety that causes. So I think, but it's true in child welfare. Who are the children who we serve in child welfare? They're all low-income children, almost without exception. And then we have the rates of addictions and substance abuse and alcoholism way higher among low-income people than more affluent people, even though there's a healthy dose of that in more affluent populations also. Who's in the child welfare system? Disproportionately people who have substance abuse and alcoholism. A research study here at USC about 15 years ago found that to be the case. That stems very much from their poverty, at least in part. So that is the staggering issue of our time, and if these students are lucky enough to see social movements, hopefully inspired politicians working on that, maybe it will rub off on themselves to become activists. But to me, that's the challenge, to really take on that issue.
That's great, Bruce. You just seem to have identified something so well that needs to be addressed.
Well, thank you. I'm just delighted.
Great, and it's great sitting here listening to you.
Well, thank you.
You're
Thank you.
welcome.
Thank you, John.